Okay, so today I'm going to teach you guys about the use of prosthetics in dogs. Like most people in here, I'm a pre-vet student, and what eventually I want to go into is designing prosthetics and orthotics, so this kind of topic's really interesting for me. And especially since as medical science increases, we are starting to bring prosthetics into animals, so it will become a new norm to see this. Why you should consider prosthetics, it's a good solution for like body weight, like we mentioned last class, that you don't want to have amputations in dogs that are huge or very fat because they can't distribute weight very well. But prosthetics fixes this problem, so that way you are able to amputate these dogs, but only if you amputate them in a certain area, which I will discuss later. Their activity level, so if these dogs continue to run and overuse their limbs, it's very good to have them on prosthetics. This allows dogs also that have lost more than one limb to remain mobile. So some dogs don't do well with wheel carts and stuff, and they like to run outside. It's better for them to have these fake limbs. And it allows overall an even distribution of weight which on all legs, which stops issues such as overuse syndrome in the sound shoulder, spine, or hip. If the dog is missing a leg, eventually the shoulder or the hip and stuff that's remaining, it'll just become overused and it can cause problems like arthritis, and it just can hurt the dog in the long run. So especially in younger animals that get amputations, you want to get them started on prosthetics. So the conditions to be able to have your animal qualify for prosthetics, you need about 2 to 3 inches of residual limb left below the knee or the elbow for a proper fitting and for the dog to walk normal again. Unfortunately, most dogs that get amputees, they cut it right below the shoulder or the hip because they don't want the limb to get snagged on stuff. But dogs that are cut here cannot have prosthetic limbs because it would just be like a peg leg. And since there's no proper joint, the animal, it would be either incredibly hard or almost impossible for the dog to get a normal walk again. So at this point, all you can do is either just leave it or put him in a wheel cart. So they should be designed and placed on the dog following surgery. That way the vet knows not to cut so high up and to cut right below the knee or the elbow. And putting prosthetics on a dog right after surgery also keeps the site clean, reduces edema, and improves mobility so the dog can learn to walk faster. So, like I said, this isn't completely necessary, but it does help the vet know what to do and the vet to know what your goals are so they don't have to worry about the limb snagging on stuff in the future.
So I suppose, I mean, that's a learning process if you're a vet and you're used to cutting everything away. And if you can leave a stub,
yeah,
then you should, but like I'm sure there's cases where they can't leave it.
Yeah, so like if the dog is hurt way too up high, or like in a car accident, unfortunately then there's only so much you can do. But if your dog is hurt below or has like a paw injury, then you can get them official prosthetic. But right now with prosthetic technology, all we can do are ones that are below the elbow and the knee. So common types of prosthetics, so right here you have a carpal prosthetic. It's for patients amputated at the carpal level that still have their medial and lateral processes left intact, along with the distal ends of the ulna and radial bones.
I love those terms.
Yep. So as you can see here, the dog still has its elbow, so its limb probably ends about right there, and then it fixes the rest of it so it can still go. Partial paw, which you can see right here, is caused by a deformity or a traumatic injury affecting the entire or the partial of the paw. So if the dog gets part of its paw run over or eaten, you can still put this little limb on it so that way the dog can still walk and you don't need to cut off more limb than necessary. And then we have a tarsal metatarsal, which is right here on the back leg, which assists with rear leg function for the canine's ambulatory movement. This allows the dog to still move, and as you can see right here, it's below the knee. So it allows the dog to properly bend its leg. So, prices of prosthetics. Honestly, the price depends on the size or the weight of the dog. Obviously, like a Great Dane that needs a prosthetic will cost more than a Chihuahua that needs a prosthetic. And depending on how much the prosthetic will need for materials and support, and what type of injury or physical debility the dog has been diagnosed with, so that will determine what type of prosthetic is going to be used. And eventually, once the style of brace has been decided on, certain styles will be more expensive. So I was looking at a bunch of different websites. The rough estimate of price was $200 to $600 per leg. But if you want one that's like better quality and one that will last a lifetime, they can reach into thousands of dollars. But these ones, usually the dogs can like swim in, they can live in comfortably. All you have to do is just make sure that the limb doesn't remain like wet, and these prosthetics can last them a whole lifetime if you do well. So any questions?
Wow,
or
that's great pictures. Man, okay.
Yeah.
So is anybody looking into, like, I know you said you wanted to work on designing these, is anybody looking into making it so you can actually use higher up? Because I know like we have robotics types of things that do that sort of stuff.
Yeah, I think right now people are working on trying to figure out how we could make the prosthetics up higher, because then we'll need to work on artificial joints and figuring out how to prevent the dogs from having like a peg-legged swooped motion to be able to walk comfortably. So I feel like as like robotics and that kind of technology advances, we'll be able to design more sophisticated prosthetics that will allow dogs with higher up amputations to eventually be fit for prosthetics. But as of now, all they can be fitted with is wheel carts.
Was there another question? Yeah, it looks like a, okay.
Have
go
you
ahead.
seen the series on Netflix? There's only one season, it's called Bionic Vet.
Oh,
And
I
he
have.
specializes in building pet prosthetics and doing the surgeries. Like he had a cat that got, run over by like a piece of farm equipment and he needed a prosthetic. He's in the UK, I believe.
Mm.
Okay.
But he has his clinic and he's like leading like the field in this.
Okay, I'll have to check it out.
It was really cool. It was, like I said, it was 6, it was only a season long, but
Now,
it
what
was
was
really
it,
cool.
what-
The Bionic Vet, or
If you- if
Bionic
there's like
Vet.
something on YouTube, send it
It was
to
on
me.
Netflix, so
Okay,
the
yeah.
series was
Oh,
on Netflix.
it was on Netflix.
I
Well,
don't
send me
think they'll
something.
have it, it was this summer, but I'll have
Okay.
to see if it's still there.
Okay. Okay, I think we'll move on.